name's Sara Velasquez.
Hi, my name is Yahweh.
Hi, I'm Kimberly Briggs.
And I'm Genevieve Gonzalez.
And this is for Mr. Nathani's 1407 chemistry class.
And today we're going to talk about non-nucleoside reverse transcriptase inhibitors.
Thank you.
HIV stands for Human Immunodeficiency Virus. Unlike many other viruses, once infected, you are stuck with HIV for life. HIV attacks white blood cells called CD4 cells, also known as T helper cells, severely impacting your immune system. When you contract HIV, the virus attaches itself to the CD4 cells and releases its contents of DNA and proteins into the cell. Once inside, HIV changes its genetic material from HIV RNA to HIV DNA using the virus's enzyme called reverse transcriptase. The HIV DNA merges with the T cell's DNA and takes control. Messenger RNA comes from the HIV DNA and begins to make more copies of the virus. The new copies are eventually released from the T cell, allowing the virus to spread and start the process all over. This eventually leads to the destruction of the T cells in the body, making it more susceptible to disease and infections. Without proper treatment, HIV can lead to acquired immunodeficiency syndrome, also known as AIDS.
HIV is spread by the exchange of bodily fluids. You can contract HIV by having unprotected sex, childbirth from the mother to baby, or through injection equipment, IV drugs, or even a needle prick. While there is no cure for HIV, with proper medical care and treatment, it can be controlled. The drugs used to treat HIV are called antiretroviral therapy, or ART. Taken daily, this medicine can prolong the life of someone infected with HIV and decrease the chance of infecting others. One example of an ART drug are non-nucleoside reverse transcriptase inhibitors, NNRTIs, or also known as non-nukes.
After entering the cytoplasm of the CD4 cell, the encoding of the viral core can occur. The magic core disintegrates, releasing the capsid with the HIV genetic material and associated enzyme into the host cell. The capsid then sheds this coat. The two viral RNA strands, which are themselves coded, and the viral enzymes are then released into the host cell cytoplasm. The reverse transcriptase or RT enzymes is then activated, and it is now ready to convert viral RNAs into single-stranded DNA.
At this stage, the non-nucleoside reverse transcriptase inhibitors, or NNRTIs, are able to block the function of the viral RT enzyme. NNRTI drugs target the viral RT enzyme. An NNRTI molecule can bind to the active enzymatic pocket or active catalytic site of the reverse transcriptor enzyme. The binding of an NNRTI molecule to RT prevents the enzyme from being able to convert viral RNA into DNA. Hence, the process of reverse transcription is inhibited and the HIV infection cycle is brought to a standstill.
After entering the cytoplasm of the CD4 cell, the encoding of the viral core can occur. The magic core disintegrates, releasing the capsid with the HIV genetic material and associated enzyme into the host cell. The capsid then sheds this coat. The two viral RNA strands, which are themselves coded, and the viral enzymes are then released into the host cell cytoplasm. The reverse transcriptase or RT enzymes is then activated, and it is now ready to convert viral RNAs into single-stranded DNA.
At this stage, the non-nucleoside reverse transcriptase inhibitors, or NNRTIs, are able to block the function of the viral RT enzyme. NNRTI drugs target the viral RT enzyme. An NNRTI molecule can bind to the active enzymatic pocket or active catalytic site of the reverse transcriptor enzyme. The binding of an NNRTI molecule to RT prevents the enzyme from being able to convert viral RNA into DNA. Hence, the process of reverse transcription is inhibited and the HIV infection cycle is brought to a standstill.
Hi. I'm at Target. I'm shopping for this party, and it's gonna be really awesome. And there's this guy, he's supposed to be there, and he's really cute. So, but I think it's gonna be the best party ever.
Hi, Mom. Do you remember I have the volunteer today? Yep, I'm late now, so can I call you later? Yep. Take care, Mom. Bye.
Hey, Jonathan.
Hey, what's up?
I put a patient in 25. He told me he was positive for HIV, so I just wanted to give you an FYI. I'm going to start some blood, get an IV started, and then go from there.
Sounds good.
Okay?
Yeah.
Thanks.
I don't know what happened that night. I mean, I thought he was a decent guy, and I guess I should go get tested like you said, just so I have peace of mind. Make sure that everything's okay.
Hi, Mom. I'm at school now, but I don't feel good today. My head feels so bad and my throat feels so like I have flu. So do you think what should I do now? Should I go to doctor? Okay. Bye, Mom.
Oh no, another fever. I don't know if I should say something or not. I don't know. I'm so confused.
Hello everyone, I just wanted to welcome you guys to the hospital's HIV support group. We just decided to do this group just to invite newly diagnosed patients here, with this it's a pretty drastic change in your life right now. My name's Dr. Velasquez. I'm an HIV specialist for the hospital. What I'm basically here for is for you guys, for a listening ear, if you guys have any questions about any of the medications you're taking, or maybe something you're going through that you don't quite understand. I'm here to help you answer any questions, basically. But since it's our first time here, let's, I guess, start with some introductions, and maybe, let's say, how about how long it's been since you know your diagnosis? So why don't we start with you?
Hi everybody, my name is Genevieve. I'm an RN, and I got stuck by a needle from an HIV person. I did not follow protocol. I kind of hid it. I didn't want to know what was going on. I knew what the consequences were, and I regret not following what I had to do.
Well, thank you for sharing that with us, Genevieve. What about you?
Hello, my name is Mia, and I just got the result a few weeks ago, and I still cannot believe it. I just was helping begin jazz, and I put my finger into the used syringe. I got sick a few weeks later, and I just thought I had the common flu, but I still worry about because I bought to the needle, so I got tested, and the test come back positive with HIV. I just was volunteering, and I like to do something to helping for the community, and I want to be a great nurse in the future. I cannot believe that can happen to me.
I understand what you mean. I mean, I was shocked when I got the results. I had the party, and he took advantage of me. And now, I don't know if I'm ever going to get married or have kids. I have to suffer now.
It's unfortunate it happened. You feel cheated, you feel angry, you feel violated. It's completely normal to feel that way. But just know that you're not alone in this. You guys have so many resources. There's groups like these out there for you guys. You can still live a normal life as long as you're taking care of yourself properly. It's an emotional journey as well as a physical one. I know the medication that we prescribe to you should definitely help.
Well, ever since I started taking medication, I haven't been myself, and I haven't been able to sleep.
Okay, well, let's see. Kim, well, you're actually taking efavirenz. That probably, the way you're feeling has a lot to do with that. This medication can cause a lot of mood swings, a lot of sleep deprivation, but that usually just occurs within the first couple of weeks of you taking it. After about that, you should go back to normal. But if there's anything like the side effects don't go away, or if it kind of gets worse, or you still don't feel that comfortable, we can always change your dosage in a couple weeks, okay, if you're still having some problems. Genevieve. Well, I see they switched you to etravirin from ribavirin. Were you having problems with that medication?
Yeah, my family has a bunch of heart problems and arrhythmias, especially heart attacks. So I kind of caught it on time, and I asked them to switch my meds, and I've been doing okay since then.
Wow, well, that's a really good catch.
Yeah.
And I feel like I just so many medication.
Well, because the virus changes so quickly and so often, different medications are prescribed in order to deal with different kinds of things. Looks like with you, they're actually doing heart with you. That's why you're taking so many medications. Heart is, well, another word for it would be highly active antiviral therapy. It's usually when they give you 3 different types of medications, just so it's different things battling the HIV. Actually, on that list of medications that you're taking, is a medication called non-nucleoside reverse transcriptase inhibitors. That's actually some of the medications that we were talking about earlier with Kim and Genevieve.
What do they do?
It messes with the virus protein called reverse transcriptase. It's an enzyme that the virus uses in order to replicate the DNA that's inside your cells. So what non-nukes do is, if you can imagine a zipper, or maybe my hand, this would be protein, would reverse transcriptase, and non-nukes will go and kind of like jam it so it doesn't like bring the DNA strands together inside your cells in order for it to duplicate. Or I guess if you can do it another way, imagine a zipper, and each side of your zipper are like a strand of DNA, and then the bottom part where you connect it would be the reverse transcriptase. If you jam that part, they can't come together. So that's what non-nukes do. They kind of jam the beginning part of the DNA, like blending it together. Does that answer your question, kind of?
Yeah.
Cool. Okay, well, actually, it looks like we're kind of out of time for today. I hope you guys had a decent time. I know it's kind of tough being here. Just know that HIV, it isn't a death sentence that it was years ago. There's so many different therapies, like I mentioned, that you can be put on. So hopefully you be able to come again next week. We can talk again, and well, I guess I'll see y'all then. It was nice meeting you guys.